part of Adrian's story is something we've grappled with in Wisconsin. I know you have in Michigan, which is obviously the denial of coverage is an issue, but it is people who are just above limits. And you know, we have worked hard in our state to keep expanding the limit at which our basic Medicaid program, Badger Care, and we're a state like Michigan that has moved it up to 200 and then 250% of the federal poverty, but that is still a very low income. And it leaves a lot of people who are just sort of over that line in very, very difficult circumstances. So I know this is something that the President cares deeply about people who are doing exactly what we want them to do. They're working really, really hard, and they just are earning too much, a little bit too much money to be able to come into one of the programs where they can get good coverage. One of the things that the President has done is reach out through his website that you saw to get questions from people all over the country about what's on their mind. And as we saw in the campaign, and now we have seen in his presidency, we have a new modern age president who is communicating with people in a lot of great innovative ways. And one of them is that there are people all across the country who are watching live stream now, and people who have sent their questions in to the President. So I want to have a question from Barb in Milwaukee. And Barb's question is one that we have talked about quite a bit here today, but I think it's worth us focusing once again on it. The question is, how will a public health focus with primary prevention be incorporated into our future health care plan? The purpose of my question is, I am an allied health professional, a registered clinical exercise physiologist working in an urban hospital in Milwaukee. Our hospital is struggling to meet its mission in serving all those in need, but it is causing our system to fail financially. The issue we just heard a moment ago about some of the struggles that the hospitals in less affluent areas are having. We continue to wait until patients have problems rather than focusing on root causes of the potential medical issue. Obesity can lead to diabetes, heart disease, etc., and providing support or coverage to lead a healthier lifestyle. So the question is, you know, what can we do? And I'm going to call on Steve Martinet, who is the president of Anthem Blue Cross of Wisconsin. There's been a lot of talk about insurance already, and I think it would be helpful to hear Steve's perspective on how insurance companies can help, as part of this reform, build in strong incentives for preventive care. Steve.
Governor Doyle, Governor Granholm, Ms. Barnes, thank you very much for inviting us to participate in this historic forum. I commend President Obama for tackling and creating a dialogue around this very important issue and giving the Americans a voice. I think this is a great thing. Governor Doyle, under your leadership in Wisconsin, Wisconsin leads the nation in expanding health care insurance to all of our citizens. Right now, currently, we're number 3rd in the country, in uninsured, lowest uninsured rate. And I think that's something we all should be proud of, but I also know in the summer, we're looking to get to number 2. So under your leadership, I think we all should be very proud as Wisconsinites with what we've been able to accomplish. I'm also proud of Anthem Blue Cross and Blue Shield because through our foundation, we were able to help that effort by providing money to grassroots organizations to get out to folks, reach out to them and get them enrolled for those people that are eligible for Badger Care Plus. So we're quite proud of that. We think it's imperative that we build on the public and the private success partnerships, the successes that we've had to address the rising healthcare costs issue that affects us all. At Anthem, every day we're working to reduce healthcare costs by helping people make the best decisions about health, wellness, and the healthcare decisions that they make to get the treatment that they need. Through our programs, such as 360-degree health, we've helped people quit smoking. We're getting folks the preventative screenings that they need, such as mammograms. We're working with our asthmatics and diabetics to better manage those chronic illnesses so they can have a better quality of life and be more productive. We believe strongly in the financial incentives to encourage and incent people to live healthier lives, to take care of themselves, to do things that lead to healthier lives. We also, through a number of our plans, cover preventative care at 100%. We don't want costs to get in the way of people getting the necessary health and wellness visits and preventive services that they need. From a government perspective, I think, creating a focus and awareness through public campaigns to improve the wellness, such as what you're doing around smoking, to reduce the number of smokers in Wisconsin. Again, that's something you should be commended for, and we're happy to participate with you in that way. We need to consider expanding programs like your Worksite Wellness Award that recognizes employers that are working to improve the health of their employees. And then I think with some of the leading edge private sector initiatives around health and wellness, think about expanding those into the public programs so folks on Medicare and Medicaid can also benefit from those. It will take a strong public-private partnership to address the role of wellness in the system, to improve the quality of care and improve the cost of the care we all receive, and to expand insurance coverage to all Americans. We need to inspire people to take personal responsibility for their lifestyle choices. We need kids playing basketball, not video games. What can we accomplish in advancing health lifestyles is only limited by our imagination and our ability to convince Americans that health care begins when one is healthy. Thank you very much for inviting us here, and we appreciate it.